We're going to discuss now with Dr. Linet MD, psychiatrist, depression. Dr. Linet.
Okay. Depression is a word in the English language that is different from the term as a psychiatric diagnosis. I will feel depressed if my patients tell me today and tomorrow and the next day that they think I'm a terrible psychiatrist. I'm going to feel bad. If I don't feel bad, there's something wrong with me. But that doesn't mean I'm suffering from an illness. An illness of depression means that you're unable to derive pleasure, interest, and joy in appropriate circumstances. So whether it's children or adults, they're not able to enjoy life in an appropriate way. It depends how severe it is. In very severe depressions, there's no joy at all. In intermediate or mild cases, people can get pleasure in certain things. But there is, in order to have a diagnosis, there is going to have to be some impairment in the ability to enjoy
What
life.
time period are we talking about that you stop getting the red flag?
Okay, well, that's a good question too. We define depression as requiring 2 weeks because one can have a situational depression. Things are going bad in your life and you're upset and unhappy.
The longer you are depressed, the harder it is to get back.
That's true. If it's neglected or just not treated, we have evidence that it's harder to.
So treating it early with medication, maybe with some counseling, reducing some of the stress factors early is the best way of healing depression?
Yes.
What happens if someone has been depressed long periods of time, but didn't get therapy? Is there any hope for these kind of people?
Yes, there still is hope. And sometimes they will respond very nicely to treatment. But it's better not to wait. And the prognosis is better if the depression has not lasted very long.
Thank you, Dr. Linet. See you also.